Once the diagnosis has been made, an MRI of the chest should be done to exclude an associated thymoma. Thyroid function at thyroid antibodies should be measured because of the increased frequency of thyroid disease. In patients with generalized weakness, who are negative for acetylcholine receptor antibodies, their differential diagnoses include neuropathies and myopathies and other disorders of the neuromuscular junction.
The antibody muscle-specific tyrosine kinase, it is a surface membrane enzyme that is essential in aggregating acetylcholine receptors during the development of neuromuscular junction. Around 10 to 20% of MG patients will present a thymoma, and 20 to 40% without thymoma will develop MG.
But what about the diagnosis? Well, the most frequent test to diagnose myasthenia gravis is via blood test, but neurophysiologically, we can identify it by the decrement of the compound muscle action potential in response to repetitive nerve stimulation. Another method is a single-fiber electromyography, which measures the firing time of two muscle fibers within the same motor unit. In neuromuscular junction disorders and in denervation, there is increased variability and occasional blocking of impulses.
Now, let's talk about the treatment. It has the purpose of controls of symptoms by minimizing the risk for adverse events. This goal can be achieved through individualized therapeutic choices. The symptomatic treatment it is based on cholinesterase and pyridostigmine being the agent for oral treatment.
The great majority of MG patients respond with inter-individual variability in tolerance. It can be prescribed at bedtime for patients symptomatic early in the morning or during the night. Culinary crisis with severe clinical deterioration is a rare event, as early immunosuppression has reduced the need for high doses of symptomatic therapy.
The immunosuppressive therapy is used in all patients with disabling symptoms not adequately controlled with cholinesterase. Firstly, the steroids are generally first-line therapy because of the rapid effect. Steroid-sparing agents are commonly associated in long-term treatment. Oral prednisone is used because of its strong immunosuppressive activity.